Using the foam roller is my way of getting a self-massage. I love this tool. I like the harder one, and I get the one with the knobs. I use the acupressure knobs. I use half a roller because you can get it into more tighter spots and corners and angles. I used to teach a foam rolling class that was always the most popular class at the studio. Start out at the buttocks with your knees bent and both feet flat on the floor. Anytime you start something new, pause for a few moments and let your body's nervous system get adjusted to the activity. Once the body gets the signal that it's safe, start to focus on just one buttocks. You can keep both knees bent, or you could have one leg straight like I do and progress your way out towards the outer hip, right where the back pocket top right corner would meet, or top left corner on the outer seam of the pants. Now we're still technically in the piriformis buttocks complex. So we are not adding pressure to the IT band. The IT band just likes a light pressure, no digging, for connective tissue safety. When you get to the side, roll over onto the bottom leg hip and then bring the top leg, foot in front, and use the top leg, foot, and leg for all the pressing like I'm doing here. The bottom arm is a support arm. It's not really bearing your weight. The top arm is keeping you steady. As you gently roll forward and back, softly side to side, and from hip toward knee, be cautious of too much pressure or the temptation to dig. This is not a muscle, so there shouldn't be any knots, just tightness. However, I like to roll a little forward and get to the point where the outer quadricep is evident, connecting by the IT band and massaging a little deeper along the muscle connection. Once you're done with the side of your leg, which you shouldn't spend too much time on, in my opinion, get into the hamstrings. The 3 hamstrings start up underneath the lip of the buttocks, so you need to be okay with getting a little intimate with the roller. And then rolling down toward the knee, we stop above the knee. We don't get behind the knee joint. You can do a little lateral movement and look at the anterior and interior cruciate ligament connection, but without any pressure, just a light little firm pressing on the area around the knee, but no rolling, rocking, or digging. Then go back up the leg and you can get to the inside inner thigh adductor group. You can get up in the growing hip connection. At some point, become an explorer of your own body. Just discover where are little tight spots. The tricky thing about the body is how we use it creates imbalances. So you might have a really big knot on one calf muscle and not on the other. I always tell the story about my plantar fasciitis. I went through all the treatments and I even got the shot in the heel, which was extremely painful. Nothing alleviated that feeling, that pain down the calf muscle and into the bottom of the foot that can mimic sciatica all the way up to the hip. until I learned about pressure point massage, trigger point massage, looking for the nerve bundles associated with the pain and working on those rather than the exact spot of the pain. A lot of pain is referral pain. But I find that my right foot turns out when I walk, and that has caused a nerve pain on the outer lateral side of my calf muscle connection at the fibula. And when I work on that area, it takes a little delicacy. So sometimes I lift my bottom off of the ground. Sometimes I cross the other foot on top to add more intensity instead of adding extra pushing. Once I've gone down one leg, I like to switch at the bottom over to the other leg, then work my way progressively up the leg on the other side. Take your time, explore, look for sore spots. I was really surprised by this big knot I found on my left lateral calf muscle. I usually don't ever get any left side calf pain, and this knot was huge, probably from the new workouts I'm doing. So sometimes you might have to spend a lot of time on one spot sometimes you have to decide when you've spent enough time. So in this instance, that large knot on the outer left side of my calf muscle, right at the connection by the bone, I was on it about 15 seconds when it did a popping feeling, and it moved down my calf muscle to the belly. And then I had to get into the belly of the muscle, which is the deepest part of the muscle, right in the center of the muscle. Dig around on that for a while. And then it was too intense, too much pain, so I had to move on. Remember to skip over the knee. You can get around the knee, but we don't want to push on the knee joint. Now, about midway up the other hamstrings, I felt the urge to move over to my hip instead of continuing with the left hamstrings, and that's perfectly fine. Listen to your body. Only you know what the body you were given needs at any specific time. You are the inhabitant. My philosophy about the human body is it was a gift, whether we like it or not, and our responsibility is to take care of it until we don't need it anymore. Just like you would a child or a pet you had for 16, 20, 30 years. Haley likes stretching with me, especially when I'm outside. Thank you, Bob, for the mat from Elevate Yoga Center in Orlando, Florida. Now let's talk about the low back. Once you've finished with the lower body, get into bridge position with knees bent, ankles under knees. Lift up if available and slide the roller under you. Or you can sit on the roller and lay back over the roller. I suggest holding the roller as you descend, coming down onto your elbows first so that you don't plop on the mat. And when it comes to the low back, you have to be your best judge. Don't want to press right on the spine. We want to be on the left side or the right side of the spine. I like starting with legs up the wall. It just gives the brain a moment to breathe, fluids a moment to redistribute. I'm doing what I call the bird nest neck stretch, which I love. My recommendation is if you're doing neck stretches, do them when you're laying down. The neck muscles don't have to work as hard to stay up above gravity. Interlacing fingers behind your head, you can lift the head right up the middle. You're holding the weight of the head. And then try moving it side to side. If you're ready to progress up your spine, remember we're not pressing down on the middle of the spine. We're trying to stay mostly on left side, right side, skip over spinal column. The vertebral column does not like a lot of pressure externally. Now I'm being spontaneous in listening to my body. Both legs had their own time individually, and now I'm doing both legs together. I'm not very good at sitting still, so I like to move around a lot when I'm stretching, even when I'm doing yoga. The roller is under my upper lower back, so I feel safe in straightening my legs and stretching my hip flexors and the rectus abdominis, and opening up the underarms, lifting the chin. But this is a pretty big back stretch, so you might want to keep your knees bent and your arms on the floor at your side. Going down each side, stop at your ribs and work, instead of up and down, a little side to side, just like you would use those intercostal muscles in between your ribs. Skip over the upper ribs around the vital organs, but get into your upper latissimus dorsi, right at that underarm. Rock a little forward and back on the muscle, never on bone. Place it horizontally with the mat for a really nice neck stretch. Rolling gently side to side. You're just pressing your head back into the roller, not a lot of pressure. I like to place the roller perpendicular with the spine and then roll my neck gently side to side right along the occipital at the base of the skull on the soft tissue in the muscle there. That muscle is so tired from holding our head up. Use your own judgment. Again, you're on muscle, not bone, and never ever on the spine. Studies have shown that using the foam roller and self-myofascial release can improve range of motion around joints, which helps you feel more mobile. None of this advice is medical. This is all just for entertainment and the reasons why I use the roller for myself. Reduces muscle stiffness and perceived tightness in the muscles is the reason why I use it on my neck. And it's the only thing that really helped with my neck pain after my bicycle wreck in Scotland. It took me a long time to work through all kinds of healing modalities. The one that really worked the best for myself was pressure point massage or acupressure massage. Finding that nerve bundle related to the pain usually can keep the pain away for quite some time. There's no quick fix for muscle discomfort and pain. try some experimenting with the roller move around. There are different types of rollers. I will do a video just on the roller balls. I love the different types of massage balls you can use to find more precise acupressure points, which we will use in our scapula area to get rid of upper neck tension. So I'll make that video for you. But look for long rollers. They make foam, super soft ones. They make really firm ones like the one I have. You can find them anywhere now. A lot of the times you'll see them at the thrift store or the budget stores. And then I finish my foam rolling session with some improv. So I stop, I take a breath, I say, hey body, where would you like me to work on you some more? Sometimes the body will say very clearly, upper back, shoulder blades. For me, usually that's the area that I have the most tension. All my stress goes right up into the shoulders. Be careful along the ribs. Again, you can go a little left and right. Use your legs for pressing. The arms are just for support. Find some of those spinae erectae spinae muscles that go all the way up from the buttocks to the back of the neck. So rolling up and down. Play around. Have fun. Give yourself a massage like you always wanted if you ever got one before. I think what I like the most is I'm in control of the pressure that's being applied. I've had tons of massages since my bike wreck, and I highly recommend sports-oriented massages. If you're dealing with an injury, there's pleasure massages, massages for relaxing, whatever you need. But if you have a specific need, make sure you seek out just the right modality for that. My pain is mostly nerve pain. Foam rolling is excellent at stimulating just the right receptors we need to reduce our overall pain perception, which is something I had to learn about. The way we perceive the pain we're in can affect the intensity of the pain. I usually save the quadriceps towards the end. I do one breath at a time while I'm working on my quadriceps because they are so intense. You can get along the outer edge, but not on the IT band again. Get the middle. The rectus femoris dives deep in the middle. So right in the middle of your thigh bone, your femur, and move around up by your front pocket. It's unbelievable how tight everybody's hip flexors are, including mine. Go slow. I recommend doing one leg at a time. If you have one of those big, really soft foam rollers, you could do both legs at the same time, but it can be intense. When you're doing your quadriceps, make sure you are in a modified plank with the forearms, elbows towards each other to keep the shoulders closed. Take it slow. You can bend the other knee and get at the deeper in that front pocket inner thigh connection there. So this upper left hip and back pocket area piriformis is so tight on me that I'm going to spend extra time, even though it's probably a level 10 on the pain. But we need to work that tissue, get the fluid out of there, get the body to reset the nerves. So a lot of people tell me they do not like the foam roller at all. It hurts too much. To me, it doesn't hurt any more than some of the massages I've had, even though I might say the type of massage I want, I wind up getting something other than what I requested. And I like it because I can control that pressure. So I decide how intense the massage is going to be. But I will agree, the body, the mind hides probably 80% of our continual pain we carry around all the time that we are managing subconsciously, which takes an enormous amount of energy. One of the reasons I like the yoga practice is it's all about conserving energy and building energy and repairing lost or draining energy. So if we're trying to build up our energy in our body, then we need to do something like this to get rid of all that pain the body's holding on to that we're not even aware of. Even though it's uncomfortable, we can stay calm in an uncomfortable situation if we practice enough. Now, there's no pain. We don't want any pain. So if there's anything sharp, shooting, stabbing, stop. There might be some other issue going on that you'll need to see a doctor about. Those hip flexors really tight. Now, I do not recommend this for everybody, but I am rolling out my rectus abdominis, so the belly of my upper body, meaning the deep muscle. So I'm doing a little left, right above my hip points on my actual belly, and rolling up towards the very first rib there. This pressure can help with digestion and elimination. Apply pressure on the right side first and then the left. We're not trying to massage internal organs. We're looking for the huge sheet of muscle we call our abs or our rectus abdominis. You want that same sore muscle feeling, not squishing organs. Just a light belly rub. And then finish however it feels right for you. Maybe you need more of an upper body stretch. I love laying over the foam roller right at my shoulder blades, supporting my head and neck. Play around, fidget, wiggle, and have fun. Explore the tight spots of your body. You'll be surprised. It's like when somebody walks up and put their hands on your shoulders. And as soon as they add the littlest amount of pressure, you realize how tight your shoulders were. But it doesn't happen until someone else touches us. And that's because our body is constantly in defense mode, managing that stress. Let the foam roller be that extra pair of hands. So just give up your tension and stress to the foam roller. When you're done, do it the yoga way. Spend a couple of moments of reflection and let it all settle in. I love rolling out my feet on the foam roller. Next video will be about using pressure balls to massage. But for now, work out any final little tight kinks. Legs up the wall is an absolute must. We should do it 3 times a week. Let the foam roller hold the weight of your legs up. And when your legs are off of the ground, they are in space, they are happy, and they want to play. So let your legs and feet move around in their own way. Inverted cobbler's pose is one of my favorites. I love holding my feet and talking to my feet and thanking them for all the places that we are going to go in the new year. You'll know when your body is done with the massage. Find a final resting pose. Give thanks to yourself. Sync your chi. Call back your own energy. Wrap it around you in a golden white ball. Restore, refresh, and renew. Thanks for rolling with me. Namaste. Hey, if you enjoyed my video, would you please share it, like it, and subscribe for future videos? Drop a comment below, question, send me a request for a video you'd like, and I'll make you a video on your subject. Namaste.